and thank you for joining us for a deep dive into the healthcare segment of the 2025 Pulse Report from M3. I am Kevin Murray, the Director of Healthcare, and joining me today is Ryan Moore, Client Executive at M3. So within the Pulse Report, Ryan, you had mentioned a number of things as far as emerging trends that went from litigation financing to telehealth to cybersecurity and the advancement of AI. So when I think of AI in healthcare, I hear things like 65% of hospitals are using AI for some element of their healthcare. 75% of us have AI on in our phone at any given minute.
AI is going to continue to revolutionize the way care is addressed with patients. And it addresses a lot of pain points within the healthcare industry. We're used to having that conversation on a day-to-day basis with our clients and our prospective clients. But the utilization of AI for services like patient monitoring, diagnostic services, medical scribes provide services that help with operational efficiency and quality of care, with the caveat of healthcare being one of the top targeted industries for cyber claims, right? And so when we have conversations of cyber, AI always comes up. From a coverage standpoint, it's important to, as a broker, understand, are there any AI type exclusions on a policy? And does the policy language actually address the specific risk? And so those are two areas where when we do audits, making sure that we're checking those boxes off, helping our clients vet AI vendors. Because we are used to dealing with AI on a day-to-day basis, both internally and with our clients, we have the knowledge and the know-how to help our clients vet through those if they're open to it. The other piece that I will say is from a contract standpoint, obviously with third-party vendors, you're gonna have contractual obligations from a liability standpoint. And so reviewing the contractual language around risk transfer and making sure that that responsibility is spread as evenly as possible.
Thanks for that, Ryan. And you talk about reviewing things. So I kind of want to jump into how M3 has used AI to enhance our client relationships, both in a safe and ethical way. So what we created is GenPro. It's an advanced AI assistant, and it has access to all of M3's warehouse of information. And so it can look through all of the policies, your applications, your claims data, or your contracts to analyze that information based on things that we're asking it. So to our clients, what does that mean? If you're a healthcare organization, say you have a robotic surgery system, if there were a claim related to a patient, what policy would be on first? Would it be your MedMail, your D&O, your cyber? Any of those could be. We can take all that information and put it in GenPro, have it analyze that information, and give us some suggestions, some information, some recommendations about things we need to look into to make sure you have the best program in place that you need for those type of claims. So knowing that with GenPro, I want to jump into another area of technology, and that is telehealth. Ryan, I want to hear more from you on why it's an emerging risk.
An emerging trend within the healthcare industry being telehealth. It historically has been around for a long time, but revamped and obviously came more to the forefront during COVID and then post-COVID as well. While it's something that's going to change the way care is delivered down the line, similar to AI, because of the way it's being done, there are some challenges to it, some things that we talk with our clients about on a day-to-day basis. As people in our industry know, licensure is dictated by the state and not on a federal level, and so there's nuances to licensure requirements and regulations. So it's important to be cognizant of what those lines are and how to properly move forward so that our clients don't get dinged on things down the line. The other piece to it, when it comes to reimbursement, Medicare and Medicaid is kind of looked at differently when it comes to billing and coding within telehealth. The other piece is prescribing medication. If you're across state lines, understanding what medications can be prescribed and which ones are not allowed. The DEA has some pretty strict regulation. Again, another really good delivery of care model that is addressing a lot of issues within the industry, but unfortunately comes with some potential risks or coverage gaps.
On our end, M3 is, of course, in regular conversation with our insurance carriers on a national level to make sure that they're in tune with the needs of healthcare clients and their telehealth needs. And beyond insurance carriers, we have a number of partners we talk with on a daily basis, from CPAs to law firms to IT managers that know what's going on, the advancements that are taking place, and how we can get in front of it. To learn more, reach out to Ryan and I, get a better understanding of your insurance and the advancements of healthcare.